I'm an MD. I graduated from medical school in 1962, and I've been in California since 1971, mostly doing ophthalmology. That's eyes and eye surgery. About 4 years ago, I decided that I would like to do medical marijuana referrals. I may call it cannabis, but it's the same thing. There are a lot of indications for using cannabis, and I'm really happy that I went into that field. But when I first started doing it, all verifications. When a person gets a recommendation from a doctor and they go to a dispensary to buy product or medicine, they have to be verified. And the way it was done before I came along and Joe hooked up with me, it used to be done on the telephone, which meant the phone rang constantly. My wife on one trip said, I'm not going anywhere with you again, like on a vacation, until you figure out a way where you don't have to answer the phone all the time, because it was a pain in the neck. Joe came up. That Joe is professional management services and the 247 care, and we have an online system where the verification is done in a manner that just absolutely could not be simpler. Everybody is issued a discrete verification number. It's on the statement that I issue them, which most people call a recommendation. I simply call it a physician's statement. And the dispensary or law enforcement or whoever needs to verify that a patient is legitimate simply goes on the website, 247care.info, and they enter a discrete number, which is usually it's 8 digits. And then their verification comes up immediately. Their name comes up, and when their statement expires. So it's very simple. And I think Joe told me one time you saved me 25,000 phone calls over the past 4 years or so, which is really remarkable. And I believe it. And in fact, I wouldn't be doing this without the online verification. It is an enormous pain in the neck. When I talk to other doctors about maybe doing this, I always have to go, well, I don't know if you can combine a regular medical practice with this, unless you're willing to pay for, and it's a reasonable cost, a verification system, so you don't have to be interrupted in the middle of surgery or clinic or whatever. Because what you don't want is for your patients to go to a dispensary, they need medicine, it's 9 o'clock in the evening and they've run out, and you don't want them to have to wait until the next morning, because some of them are going to be pretty angry at you. And so this system is up 24 hours a day. It takes literally seconds to verify a patient, and they don't have to call me or anybody about it. So this is a great system, and like I said, I simply wouldn't do it. I'm too old for this stuff to be answering the phone 47